You were saying that it was difficult before Christmas, but do you think this is going to be the hardest thing that you're going to have to deal with?
The calm before the storm. When it hits, it's going to really hit. And people are scared, but no one's listening. People don't see what I see.
Mm-hmm.
When you're in them side rooms, those people you can't hold their hand. You can't give them a hug and tell them it's going to be okay. You're actually physically watching them drown. And there's nothing you can do about it. And it's really hard. It's hard to know that you can't. Normally, like if I've got a patient and they really need a cuddle and someone to be there for because their family can't be there for them at that point in time, and they're really struggling, especially for my palliative patients, I'll sit there and I'll try to take half an hour out of my time just to sit there and talk to them, even if I'm just rambling rubbish at them, and just to hold their hand because they're scared. You can't do that. You can't stay in there for that period of time.
You just want to do everything that you would normally do, but you're just so limited, aren't you?
You don't have that option. And it's scary knowing that you can't do your job properly. Can you imagine how scary that must be for a vulnerable adult? Doesn't understand where they are, and we're stood there with masks over them, looking at them, having to roll them, having to clean them up, having to make sure they're tidy. And it's awful. It's like that anyway. And that's how it is when you treat the elderly, and you have to... You still explain what you're doing and try to reassure them, but most of the time they don't understand.
No.
There's the added pressure of they don't understand and they don't have that family member with them. That's all you want to do is hold their hand and just say it's going to be okay. Sometimes you know fully well it's not going to be okay.
Yeah.
But what do you do? Before this and after all this, my biggest piece of advice was if you don't need to come to hospital, don't come. There is so many people that come into hospital for things that they don't need to be there for. Sometimes I just want to shake people and go, why are you here? You don't need to be here. I need more education on that. Stay at home. Get chunky. Eat some rubbish and watch television. What is a couple of months on the grand scheme of things to keeping your relatives?
Yeah.
Going to the supermarket and queuing outside the supermarket. If there's a massive long queue, don't stand there and wait. Go home and come back later. You're more likely to catch it by standing behind someone in a queue who's coughed and then put their hand on the trolley and coughed, and then you get that trolley, then you itch your eye. You've got it.
Perhaps after this, everyone's going to appreciate everything a lot more, the NHS included, and hopefully there'll be some changes. How do you... I've seen you've been taking baking and cupcakes into work. How else do you, as a team, try and keep the spirits high?
So, we send a lot of memes to one another. Some of the memes, we would never share them on social media or anything like that, because that, in my opinion, sharing them on social media is just making something that's quite serious not.
You're just trying to do little things to keep the spirits a bit lifted.
Yeah. I work with amazing people, and I've worked in a lot of places, and some places I felt really happy and really comfortable, others not so much. And hand on heart, this is one of the nicest teams I've ever worked with. They are, honest, they are ace. If you're sad, they'll be there. If you need 5 extra minutes, you get 5 extra minutes. If you feel as though you're worried about something, they'll be there. If you don't understand something, someone will come help you. And I feel like all this rubbish is going to bring everyone closer. At the moment, everyone's stepping on each other's toes. Everyone has little spats because they're scared.
The last thing I was going to ask you about was how you felt after the nation came out and clapped on the doorsteps the other night.
Controversial.
Controversial.
I loved it. It was a really nice thing to do, and we appreciate it. And I appreciate that the nation cares, but why is it taking a pandemic for the nation to care? A lot of people think nurses and healthcare assistants are arse wipers. That's what they think my job is. No one's actually thought, I know something, I go tell a doctor. My patient looks yellow. I think they're bleeding. My patient has red in their bowel movements. I think they're bleeding somewhere. Why has it taken a pandemic for people to understand what we do? Oh, you only hand out drugs. You only make drugs. You only give out drugs what doctors tell you to do. Absolutely. I get paid £12.35 an hour to do my job. I could go to Aldi's and get paid double that. A lot of people don't appreciate the healthcare assistants. Healthcare assistants are the backbone of the NHS. Never mind nurses, never mind doctors. Without healthcare assistants, I wouldn't know half the things that I know about my patients. I think my healthcares deserve a pay rise. They get paid £8 an hour to do what they do. They're essential. They're amazing. I appreciate every single one of them.